Hello, my topic is about the roles and responsibilities of registered nurses. Registered nurses are nurses in the hospital who have at least an associate's degree. Um, they can work in many places like hospitals, nursing homes, schools. They can work in rehabs or mental institutions. So there is a quite demand for nurses. But we have to know what the actual definition of a nurse is. My speech is gonna be about the definition of a nurse. Many people believe that just the simple responsibility of a nurse is just to manage their patients and just give them medications, and that's it. That is, there's way more to that than just two, three things. Nurses have a lot of responsibilities. They have to assess their patients, they have to establish plans of care, and they always have to consult with the physicians and keep everybody updated on the patient so that there will be no errors in the hospital or the area of location. According to the National Council of State Boards of Nursing, um, an RN's scope of practice can include management of care, safety and infection control, psychosocial integrity, meaning their socialization and their mental feelings, and how they present themselves. It's the nurse's responsibility to make sure patient is not just in depression and we're forcing this patient stuff to do. You have to have everybody how can I say this? You have to have your patients in quality care, as in they have a sense of their social feelings. Also, nurses have to establish plans of care, like I said. This is more than just few steps. There's a lot of steps in establishing plans of care. You have to look into the patient's history, family history, if they've ever been hospitalized or into an emergency room. You have to know why and when they were hospitalized. You have to know stuff like their mental history, if they've ever been into mental places. You have to know the sociological and spiritual needs. You have to understand their culture. Culture comes in a place in this, because if you have a Muslim patient, and sometimes female Muslims are don't make eye contact with males. So if you have a male nurse assigned to a female Muslim patient, cultural can come in the way and there can be readjustments in the hospital. Besides this, nurses can ask questions regarding these subjects and expected that the patient can answer it truthfully, so then everybody can work very good. While assessing a patient, the nurse may observe the patient's eye contact, their posture, and the way they are speaking. And also, when nurses give bed baths and stuff like that, they note for ulcers and any abnormalities in the body. Nurses are also supposed to take your vital signs almost every 4 hours or 2 hours, and it depends on the patient. If they're very critically ill, nurses take their blood pressure and vital signs and everything every 30 minutes. So depending on the subject, the vital signs include of blood pressure, temperature, respiratory rate, your pain level, and oxidation in the body. All of this can help nurses know if anything is gonna go wrong. This is important. This is quite a lot of responsibilities nurses have, but it's not just this. They also have to establish plans of care, meaning if a patient comes in, they have to, and they're assigned to this patient, they have to understand what is the problem, the chief complaint of the patient, and they will have to build a plan of care, meaning their plan to help make this patient recover and be able to do things that they were once able to do and they are not able to do at the moment, which is the reason why they are hospitalized. And they, for example, if a patient comes in with frostbites, a nurse will have to establish a plan of care according to frostbites on this patient, meaning they will give heating pads, warm foods, they will have everything warm for the patient. That is the plan of care. And in the end, the patient will be better, hopefully, and no crazy, more serious problems will occur. And that is the goal of a nurse. Besides that, a nurse has to work with their doctors, always go by the doctor's orders. They have to keep every supervisor updated on their patient, because if a patient's blood pressure drops a lot, everybody should know, just in case anything goes wrong. Everybody is aware. This is an example of a proficient working environment. Communication skills come a lot in this, because you have a lot of talking to do with your patient, with your co-workers, with your supervisor, with the doctors, everybody around you. Hospital is everything about communication. Besides this, nurses, give me 1 second. Okay. Nurses have to make sure everybody is safe. Everybody around them is safe. For example, a patient, they have to, every time they come into the room, their bed size on the bed frame has to be up so the patient does not fall, especially older patients and younger children too. The younger children tend to be curious and touch a lot of things around the hospital and could be dangerous. So it's the responsibility of nurse to make sure everybody is safe. Nurses have to help older people get out of bed, come back in bed, assist them in wheelchair, crutches, canes. They have to do that. And when it comes to post-surgical patients, they have to be critically cautious of any changes that come in the patient, because after surgery, some patients can lose blood. Some people, their temperature goes really down. They can't breathe, or their oxidation level goes down. The normal oxygen level would be between 95 through 100, and if the machine comes up and you're testing the patient and you're testing for the oxidation level and it's 87%, that's a problem, and you should get help and report it to the doctor. You should go, your first concern is your patient. Is your patient okay? And if they are okay, you test every other vital sign and you bring the doctor in. You try to do anything to bring their oxidation level back up. Nurses have a lot of specializations. They can either be a pediatric nurse, a psych nurse, a neonatal nurse. They can be an emergency room nurse. There's a lot of specializations. And each nurse with their specialization, for example, a neonatal, they assess newborns that are up to 1 month years old, 28 days. And they note every single vital sign, every piece of information that they need, because some newborns are very young, premature babies, for example. It is main concern, the doctors are not always there to watch the baby, but the nurses are. Therefore, nurses have an extreme responsibility. They are always on the floor, always ready for anything. And I believe that nurses have the biggest battles in the world. They have a lot to consider, a lot to fight for. They're supposed to give positivity to their patients, help everybody out. And all this information really does sound like a lot, but I feel that any nurse who is trained to do this, any nurse that is built for this, they can effectively help everybody get better. While that is the broad concern of a nurse, but in order for a patient to get better, there are many steps, many responsibilities to come into play. And I hope this was very informative, as the speech is supposed to be a definition. And thank you for watching. Bye bye.